Now let's review the contraction-stress test. So the contraction-stress test, this is normally done after we got a non-reactive, non-stress test, which we reviewed in the previous video. Now, because of the cost effectiveness of the contraction-stress test, most of the time we don't do contraction-stress test even after a non-reactive, non-stress test. And so in the case of a non-reactive, non-stress test, usually we do a biophysical profile, which is what we will review in the next video. And only in the case that the biophysical profile is 4 or 6, then is when we do the contraction-stress test. So contraction-stress test is we are going to evaluate during a window of 10 minutes. We need to have at least 3 or more contractions. Either this could be spontaneous contractions, or this can be induced contractions. If these are going to be induced contractions, this could be with oxytocin or with nipple stimulation. So if the patient is having spontaneous contractions and they are more than 3 or equal to 3 during 10 minutes, we can evaluate the fetal heart rate with those contractions. But if the amount of contraction is less than 3 during 10 minutes, then we induce the contractions with oxytocin or with nipple stimulation. And what we are going to evaluate is for the presence of late deceleration. So in previous videos we defined deceleration, late deceleration, but a late deceleration is going to be a decrease in fetal heart rate for more than 10-15 beats per minute, and this is a gradual deceleration. So from the onset of the deceleration to the nadir of the deceleration, this is greater or equal than 30 seconds. But this should be less than 2 minutes, because if this lasts more than 2 minutes, then we will call this a change in basal heart rate. But so this should be greater than 30 seconds, the onset to the nadir of the deceleration. And the most important thing of early deceleration and what characterizes it is that is late than the contraction. So we saw this in a previous video, but if we have here we have the register for the contraction. So let's say we have contraction 1, 2, 3, 4 contraction, and a deceleration is a decrease in fetal heart rate, but this would be a late deceleration. So here we can see how is the contraction, and after the contraction the deceleration. So they are not like synchronism, they are not at the same time. That would be an early deceleration, and that would be okay. No, this is after a contraction. After a contraction, then we have a delay in the deceleration. So these are not in phase, these are off phase. And here we see how from the onset to the nadir, they are more than 30 seconds. And this is a decrease in fetal heart rate lasting more than 30 seconds from here to here, a gradual deceleration, which is late to contraction. If we have more or equal to 50% of late decelerations find during these 3 contractions in 10 minutes, this is a positive contraction stress test. So this is worrisome. This is worrisome. This could mean that the fetus is hypoxic, and the management of this is prompt delivery, obviously depending on other factors like what is the gestational age and if indeed the fetus is hypoxic. But most of the time, if we have positive contraction stress test, especially if we have a non-reactive non-stress test, the management should be delivery. A negative, we can think of a negative contraction stress test as having less than 50% of late deceleration within 3 contractions in 10 minutes. So here we have 4 contractions, but we can use 3 contractions. So 1, 2. Here we have 3 late deceleration. Here we can see how they are off phase of the contraction. Here we have 3 decelerations in the 3 contractions. So here we have 100% of late deceleration. This would be a positive contraction stress test. If we had, for example, just one, and the other, let's suppose, are early decelerations, which are the ones that are on phase with the contractions, we can say this is a negative contraction stress test. But more accurate, we can say that a negative stress test is a register where when we don't have late deceleration nor significant amount of variable deceleration. We review what is variable deceleration in previous videos. And an unequivocal contraction stress test will be what is between these. So could be having less than 50% of late deceleration, but having no significant or moderate variable deceleration, for example. Also, 50% of the positive contraction stress test indeed is not a fetus that is hypoxic, so we have like 50% false positive with this test. So we do not only consider the contraction stress test, we also consider other factors. For example, the grade of variability of the heart rate. We can have a moderate variability of heart rate, that is good, or we can have no variability, that's bad. We have no variability or minimal variability. So even though we have a positive contraction stress test, we should look at other things. For example, the variability of the fetal heart rate. Here, this is like normal variations of the fetal heart rate. But so in summary, the contraction stress test is depending on the amount of late decelerations provoked or in response to a provoked or spontaneous contraction, and this is done after a non-reactive stress test or after a biophysical profile 4 or 6, but there are contraindications to do the contraction stress test, and this is contraindications to the stress test. Contraction stress test is when provoking a contraction could have bad outcomes. For example, if we have premature rupture of membrane, or if we have a preterm baby, or surgeries to the uterus. For example, having a classic incision for C-section. Well, remember that if the lady has a contraction in a uterus which has classic C-section incision, there is a risk of uterine rupture. Or if we have had surgery for endometrial uterine polyps, so myomectomy, or placenta previa, because remember, placenta previa is when we have a low-lying placenta at the cervical os, and if there is a contraction, that stretches the placenta. At some point is going to be stretched, and that puts stress on the placenta, and the placenta is going to bleed. So that's contraindication to contraction stress test. Also, that is the reason for which, if the patient has placenta previa, is to a contraindication to do a vaginal delivery, and the way of delivery is a C-section. Other contraindication to this is that the patient has an insufficient cervix or incompetent cervix. So because if the cervix is incompetent and we do contraction, then that could be a vaginal delivery. So no, these are the contraindications to do contraction stress test. So contraction stress test is done after we have a non-reactive non-stress test. But remember that each time we have a non-reactive non-stress test, first we do a vibroacoustic stimulation, and if after the vibroacoustic stimulation the non-stress test continues to be non-reactive, then we can do a contraction stress test or biophysical profile. If biophysical profile is 4 or 6, then we do contraction stress test, which is evaluating the amount of late decelerations with respect to the contractions. More than 50% of late deceleration in a 3 contraction during 10 minutes is a positive contraction stress test, and we should evaluate for delivery. Also, we should consider other factors, for example, the variability of the fetal heart rate. Negative contraction stress test is having less than 50% of late decelerations, but other way of thinking about this, because we can have late deceleration, but that is not good anyway. So is a negative contraction stress test is having no late decelerations and no significant variable decelerations, and an equivocal contraction stress test is anything between them. For example, having less than 50% of late decelerations, or having variable decelerations but no significant variable decelerations, and moderate variable deceleration, for example. And contraindications to this is premature rupture of membrane, preterm baby, surgeries in the uterus, placenta previa, and incompetent cervix.